When a patient's in a position to decide which treatment to go for, there are a number of considerations really. Surgery gives you the surety, the certainty that the cancer's been removed, whilst radiotherapy leaves more uncertainty. But the side effects of surgery in terms of incontinence and sexual dysfunction are worse than after radiotherapy, especially brachytherapy.
If you don't like the idea of surgery, still you need to go and see a surgeon and talk about your concerns regarding surgery. You would see a radiotherapy specialist to talk about external beam radiotherapy and about brachytherapy, and then have time to think about it before you make your final decision.
However, brachytherapy is not so good when the prostate is large. It's not so good when the patient has severe symptoms of prostate obstruction, because the seeds that are placed inside the prostate can make it swell and make the passage of urine even more difficult than it already is.
All the specialists will guide you, but I think ultimately you will have to have a say in which treatment option you can have.
External beam radiotherapy is a good treatment for prostate cancer, but in men who already have bowel disturbance, then the side effects of the radiation on the rectum can make the bowel disturbance even worse, in fact disabling. So these things need to be taken into account, and of course there's active surveillance, which is basically observing and monitoring the patient carefully, is a good option, usually in men who have what we call low-risk cancer.
And so we encourage patients to learn as much as they can about the procedures, not just by reading about it from brochures, but perhaps looking on the internet, talking to people who've had these treatments, and then they have to weigh up which of the complications they could live with, which is more important, the certainty of outcome or the minimal aspect of the intervention.